Hello, everybody. So here we begin Chapter 6, the Health Services Financing. This is the thing that probably changes most drastically on a regular basis, and so far probably our meatiest chapter. So again, as with every other chapter, you will make sure that you cover the learning objectives written here, understanding the purpose and role of this chapter. As we get into this and you're looking at our PowerPoint, the thing that's really interesting is, as I say, how does insurance overlap? How do some people have multiple insurances and others have none? People are right now extremely cranky about paying for the fact that they did not sign up for an insurance. And so, one friend is saying, oh my gosh, I have to pay $400. And I said, so why didn't you choose or select an insurance? And they said that because it would have cost them double that over the same quarter if they hadn't done that. And so I'm very curious to know what is attempted. The ACA attempted to facilitate this insurance purchase, right? And that is the challenge that we're having right now and all the government issues that we're discussing. When you come down into the next thing, when we start to talk about the role and scope of health services financing, one of the biggest things, and all of you folks who work in healthcare right now will see that there is so much disparity and difference that I think that you have a billing department that literally keeps track of everything and probably get daily announcements and changes. As a person who uses the healthcare system, I get so frustrated when I get there and they say, oh, well, your health insurance has changed and you no longer have this sort of coverage or that sort of coverage. And so sometimes when you take a look at this, I think it's very interesting is that insurance increases the demand for healthcare. So when I know that something is covered, I'm more likely to get it looked at or taken care of. If I'm unsure, then I sort of let it go. And then that, of course, creates huge problems on the public health issue as we go through. So as we're looking through and we're checking to see the finances and what goes on, what's really important to understand is that the primary goal or the primary purpose of insurance was that it is supposed to be a mechanism to protect against the risks, all the different financial losses, and to ensure that people actually get the care that is available to them. Unfortunately, some of the things that we're seeing and how we are controlling the costs is actually very scary. Right. So as we increase the health premiums, then expenditures would obviously increase, yet the supply and the people who seek out medical attention decreases. So then that's sort of a dial that doesn't work. Also, as we maintain sort of status quo on the charges and the reimbursements, what then happens is there's no funding for research and development. And so from those types of things, we get very concerned about what's going on and what's happening in that world. When you start to take a look that insurance agencies assume the risk, and that's like us, the company, the corporation, the insurer, or the underwriter. And then the underwriter is trying to decide what is the risk benefit ratio and how that works. And so always, the risk for insurance is the individual, right? So what's their behaviors, the unpredictableness of their behaviors. And so what we start to talk about is some of those informations that we discussed last week about what do you have in your home, what's going on, what's happening, who's using that information, do I have a gun, am I on certain medications, what do I believe, what's my background, all of that type of things. And so as we get through that, some of the ways in which we're trying to control financing may or may not be one of the sort of top priorities or the best ways to do it. And so we're taking a look at this. This is a great chart that sort of gives all of those things and what's happening and what's going on. When we're talking about basic services, who receives those, what happens, what's the demand for those? And again, if people are insured, you can see that the demand becomes higher. The insurance will be paid. However, for basic coverage or basic services, the interesting thing is how much is paid and to what extent. And so we keep sort of going around our little box in who's utilizing and why based off of literally if they can afford it. And so that's sometimes unfortunate. When we get to the actual private health insurance, there's some basic terminology in your textbook that you're going to want to try to understand. We talk about who's the insured, what the premium is, the actuarial assessment of risk. How do they do that, and how do they determine how much of a risk you are as a client? As we're looking at these things, we have to first and foremost talk about, the premiums. And the premium is the amount charged by the insurer to the insurer to insure against any type of risk. So the premiums are typically employer-employee cost sharing. That's how most of us do it in our country. Then we start to take a look at that risk rating, which I just mentioned, and there are 3 methods that we talk about when it comes to that. Based off of your insurance, who does which way of doing that. And that's an interesting thing to take a look at, and a fun thing to dig deeper into. Then we start to talk about, some cost sharing things, and we talk about the deductible. And this is where the insured pays before the insurance will pay anything. So if you have a program like that, then you must pay up to $500, $5,000, depending on what it is. Very similar to your car insurance. If you get into an accident, you pay the first $500 worth of damage. The same thing here. Sometimes it's per family, sometimes it's per family member. Very interesting how they go about doing deductibles. The copayment is that you pay some sort of amount each and every time you go for services. And then the coinsurance, and this is something that is really interesting, but who gets coinsurance and how does that happen? And do you have 2 insurances? So if 2 people work, do you both get insurances? How does that get covered? And then when we start to take a look at what benefits or what services are covered, this is something really interesting because each and every one of us has a different plan and is oftentimes difficult to choose. So here we start to begin looking at the different types of private insurance, and you can see why people's heads spin and they say, oh, I'm just not going to get any insurance because I don't even know. It's one of those things where there's so many decisions and you feel sort of like you're getting ripped off and you don't know what you're talking about and you're afraid to select the wrong one. So of course there's group insurance, and group insurance is really where an employer provides some type of insurance coverage. The interesting thing is here is that there are certain things that are mandatory, and employers get incentives for offering this to their employees. So this is really interesting. When you get to self-insurance, of course, this is where you yourself purchase your own insurance. And the thing that's interesting here is that there are non-mandatory coverages. So if we had group insurance, there are things in there that are mandatorily covered, routine well care visits and such. But when you get to self-insurance, some things are not covered. And you would think like, well, I don't understand. Why are you forcing me to pay for this when it's not covering the basic things that are the premise of why we all need insurance? So that's a little bit frustrating as you go through and take a look at some of those things. Really tricky, and much research is needed when making those decisions. And then when you're looking at individual private health insurance, those who are not covered under employer plans and can afford to purchase insurance privately do so. And so these guys might be self-employed, they might be farmers, these are our entrepreneurs, these are the people making hundreds of millions of dollars, and these are the people who you may have seen on that famous TV show where you actually get your concierge doctor who shows up and to your home and takes care of you. So these people are usually pretty well cared for. When you get to the managed care programs, these are really interesting because we have HMOs and we have PPOs. And interestingly enough, some of those fall underneath the group insurance categories that you can participate in and see what's happening. There are lots of discussions and lots of information related to those. PPOs are the preferred provider organizations, and this is when a physician or a doctor's office or some sort of healthcare provider has agreed to be a part of an insurance plan, and they will accept whatever payments or amount of money has been pre-agreed upon per visit or something. And so that's an interesting thing. Health maintenance organizations were pretty popular back in the 80s, and you see less and less of them at this point in time, particularly in our area. But an HMO would be a place where you could go and everything's right there. So you would get your x-rays, your any blood care, you would get nutritional consultation, you would see your primary care physician. Everything would happen right in one place under one building. The pharmacy is there, sort of an all-one stop. And interesting to see how that was and how that worked out, and people liked it and didn't like it. When you get to the next thing, then we have these high deductible plans, and they do all kinds of things so that you can look at that on Exhibit 6.1. But these are for people who, I don't know, have sort of super healthy and don't worry about it. And of course, the monthly payment for that type of insurance is less expensive, but if something were to happen, then it's costs a lot of money. We have short-term stopgap coverage, and underneath this, it's people often leave an employer for various reasons, and so in between that, while they're not covered, we sort of have one of these, this sort of thing that we get people to get some medical coverage with. We have Medigap, which is sort of, again, a gap for people. They pay for people who cannot afford or do better cost sharing for people who are on Medicare. And so those are some things that are really, really interesting. When you begin looking at the trends in private healthcare insurance, these become maybe frightening or enlightening, depends on what it is that you want to think about. And so we want to take a look at those in your textbook. Table 6.1 all the way through talks about some of those interesting things. And the ACA made it mandatory that jobs-based health insurance was supposed to go into effect in 2015, but then some things happened and different changes, and so now it's called this pay or play or play mandate, which is required that they give some sort of insurance benefit that is your employer, or they actually pay a penalty. So based off of the different sizes of the employer, depends on what they need to cover and what they need to do and how much they have to pay. I'm sure each and every one of you note that in any type of annual salary negotiations that the insurance fees go up, and how much more do you, the employer, have to put in order to maintain that. So it's interesting to see what has gone on and what is happening there. So from that standpoint, the lots of different stuff is happening when we take a look at that cost sharing through. One of the things that you want to take a close look at is this figure 6.7, where we're starting to talk about in 2015 what actually happened and where the actual money is spent when we talk about the US dollar and how it goes along. And so these are some things that you might want to pay close attention to. The other thing is that this chapter really starts to open our eyes to how many different ways in which we have things paid. Try to think on a larger scale about why it's important and why this becomes a public health challenge, because again, what are some of those health disparities, and what's our primary concern all the time about those who are at greater risk and those who have then the least accessibility and the ability to even maybe get quality health insurance. So based off of that, those are sort of the highlights of this chapter, and understanding all of the actual terminology is a challenge and changes on a regular basis. So understanding the basics is probably really our goal for this chapter. So I hope all is well. Take care. Have a great day.